Depression. It's a word we hear often, but its true meaning can be difficult to grasp. We all experience sadness, moments of feeling down. It's a normal part of life. But depression is different. It's a shadow that lingers, a weight that holds you down, making it hard to find joy or even function in daily life. Imagine a day when getting out of bed feels impossible. Simple tasks, like showering or making a meal, become monumental challenges. The things you once enjoyed, the people you love, seem distant and unimportant. This is the reality of depression for millions of people. It's not a sign of weakness, a character flaw, or something you can simply snap out of. Depression is a real medical condition, just like diabetes or heart disease. It affects people of all ages, backgrounds, and walks of life. Understanding this is the first step towards overcoming it. By recognizing depression for what it is, we can begin to break down the stigma surrounding it and open the door to seeking help and finding healing. We all have days when we feel down, discouraged, or even hopeless. These feelings are a normal part of the human experience. But how do we know when it's more than just a bad day? When does sadness cross the line into depression? Depression is more than just feeling sad. It's a persistent state of low mood and loss of interest that affects your thoughts, feelings, behavior, and physical well-being. It's like a dark cloud that follows you everywhere, casting a shadow over everything you do. If you're experiencing 5 or more of the following symptoms for at least 2 weeks, it's important to reach out to a healthcare professional. Persistent sadness, feelings of emptiness or hopelessness, loss of interest or pleasure in activities you once enjoyed, significant weight loss or gain or changes in appetite, difficulty sleeping or sleeping too much, fatigue or loss of energy, feelings of worthlessness or excessive guilt, difficulty concentrating, making decisions, or remembering things, restlessness or feeling slowed down, thoughts of death or suicide. Remember, these are just some of the common signs of depression. Everyone experiences it differently. If you're struggling, don't hesitate to seek help. Why do some people experience depression while others don't? It's a complex question with no easy answers. While life experiences play a significant role, there's also a biological component to depression. Our genes and brain chemistry can make us more susceptible to this condition. Imagine our brains as intricate networks of communication, with billions of nerve cells constantly sending messages to each other. These messages are carried by chemicals called neurotransmitters, and imbalances in these chemicals can disrupt the brain's delicate balance, leading to mood disorders like depression. Research suggests that certain genes may increase our vulnerability to depression. If a close family member like a parent or sibling has experienced depression, your risk may be higher. It's like inheriting a predisposition, a blueprint that makes you more susceptible. Furthermore, imbalances in key neurotransmitters like serotonin, dopamine, and norepinephrine have been linked to depression. These chemicals play crucial roles in regulating mood, sleep, appetite, and motivation. When their levels are disrupted, it can significantly impact our emotional well-being. While our biology lays the groundwork, life experiences can act as triggers, pushing us towards depression. Just like physical stressors can weaken our immune system, making us more susceptible to illness, emotional stressors can take a toll on our mental health. Imagine carrying a heavy backpack. At first you might not feel the weight, but as you add more and more, it becomes increasingly difficult to carry. Eventually, the weight becomes unbearable. This is similar to how stress, trauma, and difficult life events can contribute to depression. Prolonged exposure to stress, whether it's from work, relationships, financial difficulties, or other life challenges, can deplete our emotional reserves and increase our vulnerability to depression. Traumatic experiences like childhood abuse, neglect, violence, or the loss of a loved one can leave deep emotional scars, making it harder to cope with life's challenges. Even seemingly positive life changes like getting married, having a baby, or starting a new job can bring stress and trigger depression. These events, while joyful, require significant adjustments and can disrupt our routines, support systems, and sense of self. When depression casts its shadow, seeking professional help is crucial. Just as we would consult a doctor for a physical ailment, we need to seek support from mental health professionals who can guide us towards healing and recovery. Therapy provides a safe and confidential space to explore our thoughts, feelings, and behaviors, helping us understand the root causes of our depression and develop healthy coping mechanisms. Imagine having a compassionate and trained listener who helps you untangle the knots in your mind, providing clarity and guidance. There are various types of therapy effective for treating depression. Cognitive behavioral therapy, or CBT, helps identify and change negative thought patterns and behaviors that contribute to depression. Interpersonal therapy, or IPT, focuses on improving relationships and communication skills to reduce stress and enhance social support. Psychodynamic therapy explores past experiences and unconscious processes that may be influencing current emotions and behaviors. Mindfulness-based therapies, such as mindfulness-based cognitive therapy, or MBCT, teach techniques to become more aware of our thoughts and feelings without judgment, helping us manage difficult emotions more effectively. Finding the right balance: medication and medical interventions. In some cases, therapy alone may not be sufficient to manage depression. Just as we might need medication to regulate blood sugar levels in diabetes, medication can play a crucial role in restoring chemical imbalances in the brain that contribute to depression. Antidepressant medications work by increasing the availability of certain neurotransmitters in the brain like serotonin, norepinephrine, and dopamine. These chemicals play vital roles in regulating mood, sleep, appetite, and motivation. It's important to remember that medication is not a quick fix. It may take several weeks or even months for antidepressants to reach their full effectiveness. It's crucial to work closely with a psychiatrist or qualified medical professional to find the right medication and dosage for your specific needs. In addition to medication, other medical interventions like electroconvulsive therapy, ECT, and transcranial magnetic stimulation, TMS, may be considered in severe cases of depression that haven't responded to other treatments. These therapies stimulate the brain to help alleviate depressive symptoms. Moving towards the light, the power of lifestyle changes. While therapy and medication provide essential support, lifestyle changes play a crucial role in managing depression and preventing relapse. Imagine these changes as building blocks, each contributing to a stronger foundation for mental well-being. Regular exercise is a powerful antidepressant in itself. Physical activity releases endorphins, which have mood-boosting effects. Aim for at least 30 minutes of moderate-intensity exercise most days of the week. Find activities you enjoy, whether it's walking, running, swimming, dancing, or gardening. Nutrition also plays a vital role in mental health. Just as a healthy diet nourishes our bodies, it also provides the building blocks for a healthy mind. Focus on consuming a balanced diet rich in fruits, vegetables, whole grains, lean protein, and healthy fats. Limit processed foods, sugary drinks, and excessive caffeine, which can negatively impact mood and energy levels. Building resilience. Cultivating healthy coping mechanisms. Life is full of challenges, and developing healthy coping mechanisms is essential for navigating difficult emotions and preventing depression from taking hold. Imagine these coping mechanisms as tools in your emotional toolbox, ready to help you manage stress, anxiety, and negative thoughts. One effective coping mechanism is practicing mindfulness. Mindfulness involves paying attention to the present moment without judgment, observing our thoughts and feelings without getting swept away by them. Techniques like meditation, deep breathing exercises, and yoga can help cultivate mindfulness. Engaging in activities you enjoy is another way to cope with stress and boost your mood. Whether it's reading, listening to music, spending time in nature, pursuing hobbies, or connecting with loved ones, make time for activities that bring you joy and relaxation. Building a strong support network is crucial for mental well-being. Surround yourself with supportive friends and family members who listen without judgment and offer encouragement. Joining support groups or online communities can provide a sense of belonging and shared experience. Hope on the horizon, you are not alone. Depression can feel incredibly isolating. It's easy to believe that you're alone in your struggle, that no one understands what you're going through. But it's crucial to remember that you are not alone. Millions of people around the world experience depression, and there is hope for healing and recovery. Reaching out for help is a sign of strength, not weakness. Talk to a trusted friend, family member, doctor, therapist, or any mental health professional. Sharing your experience with someone you trust can be a powerful first step towards healing. Remember that recovery from depression is a journey, not a destination. There will be good days and bad days. There will be setbacks and triumphs. Be patient with yourself, celebrate your progress, and never give up hope. With the right support, treatment, and self-care, You can overcome depression and reclaim your life. You are stronger than you think, and there is a brighter future ahead.